Well, Tao, you go to the hospital to get better, but what if you end up with an infection that could kill you? In this Call 3 consumer investigation, Lindsay Paulo explains why some people say hospitals are not doing enough to keep us safe.
I don't know what to do. I gotta be here. I've got to protect my kids. I've got to provide for them. Of course
Julie Autry says she was a healthy, active mother of 4. That changed after having spinal surgery at UC Davis Medical Center last year. The surgery was successful, but when she got home, she became very sick.
It was the heat and the pressure and just this unimaginable pain that, I don't know, it was really difficult.
Autry had a hospital-acquired wound infection. UC Davis Medical Center says she contracted a strain of strep A and staph, the most common types of infections patients contract in the hospital. The med center treated her with antibiotics and says she responded well.
I went in there expecting to be better, and I thought I was.
The Centers for Disease Control says 1.7 million people get hospital-acquired infections each year. 100,000 die. The added healthcare costs are in the billions. California hospitals have to have policies in place to prevent infections, like washing hands between patients and maintaining clean environments. But Michael McCauley of Consumers Union says there is no way to tell how often hospitals comply.
If hospitals were doing a better job of following proven effective infection control procedures, fewer infections would be happening.
Consumers Union says hospitals would work harder to reduce infections if they had to tell the public their infection rates. 22 states have infection reporting requirements. California is not one of them. Jan Emerson is with the California Hospital Association.
Hospitals support public reporting of hospital-acquired infections. We understand that when you report this information to the public, it's really going to help hospitals focus in both on their infection control procedures and on the preventative things that can be done.
But the Hospital Association supports public reporting only if it's risk adjusted. That means taking into account which hospitals treat really sick and infection-prone patients. A task force is developing a public reporting plan for California, but Senator Elaine Ahlquist doesn't think it's happening fast enough.
Hospitals ought to be a safe place where you do get healed and you don't pick up something else that's going to kill you.
Ahlquist wrote a bill requiring some public reporting and creating a consumer website. In the meantime, the Hospital Association says you should ask hospitals and doctors questions. So that's what we did.
KCRA 3 Investigates sent letters to 24 area hospitals asking 4 questions. Do you track infection data? Do you report it within the hospital? Do you report it outside the hospital? And would you share infection data with us?
I would be eager to learn what you learn.
6 hospitals didn't respond at all. Here's a sampling from those that did. Kaiser Permanente reports to internal quality control teams. Sutter Hospitals to medical staff committees and regional board of trustees. UC Davis Med Center reports to multiple committees responsible for patient safety. However, none of the 24 hospitals would share infection data with us. Some saying public reporting is not mandated and they look forward to complying once it's law. Julie Autry says it can't happen soon enough.
It's just been, a couple hurdles that I did not expect to have to go over.
She hopes reporting rates will make hospitals cleaner and safer. In Cohasset, Lindsay Paulo, KCRA 3 reports.
Now, that state task force recommends public reporting in 2009. Senator Ahlquist's bill calls for initial reporting in 2010. But of the 22 states with laws, only a handful have actually released reports. Now, for more information on what you can do to protect yourself from infections and to read the answers to the questions we asked area hospitals, go to kcra.com/call3.